They talked on how IMiDs are actually cooperating, are actually regulating enhancer regions. It was very, very interesting. As a matter of fact, we agree, I agree with what he was presenting. I think we've seen some of those same things. We are not so focused on how specific drugs are regulating the chromatin, but it was very interesting to see the results of those findings and give us some information that we may try to apply to some of the studies we are doing. Then the CoMMpass initiative, which is, I think, absolutely great. For the first time we've been able to work everybody together to accomplish something that is going to be important. It's going to be a huge resource for all the community and also for the patients. And seeing how they are not only looking into like classical sequencing and target sequencing exome and so forth, but they are also looking into methylation, and they are using, well, I think, very good technologies that are going to be able to give us, like, again, a larger perspective of how DNA methylation is participating in myeloma. Many of the studies that some groups have done, as well as us, are to some extent limited by the number of samples we've been able to address. And when we talk about a disease with so many genetic subtypes, so many different mutations, unless you can really get a large number of samples, you never get to address some questions like what is the difference? What are different methylation profiles, DNA methylation profiles in patients with specific mutations and so forth. So seeing that they are working on that, and they are getting results with DNA methylation in the CoMMpass initiative was really very interesting as well. So it was a very, in my opinion, from previous meetings, we had in previous meeting maybe 1 or 2 talks on epigenetics. This time there was a whole session of epigenetics. It's for people like us that we are working on epigenetics for quite a long time. It's reassuring to see that epigenetics is getting more attention, because I think it's going to be important, not only in understanding the disease, but also because there are new drugs that are targeting epigenetic mechanisms and that may play a very significant role in treatment of the disease.